If you have knee osteoarthritis, you may have heard about PRP injections. PRP stands for Platelet-Rich Plasma. This treatment has become popular because many studies show it can reduce pain and improve function, especially for mild to moderate arthritis. Hi, my name is Dr. Marc Gruner, and I'm a board-certified sports medicine physician. Before we get into exactly how the PRP injection is done, let's talk about why the PRP is a good option for some patients. One of the biggest advantages of PRP is that it uses your own blood. That means there's no risk to allergic reaction or disease transmission. Research also shows that PRP may provide longer lasting relief than traditional steroid or cortisone injections. While steroids often may be temporary, PRP has longer lasting benefits that can last 12 months or up to several years in some patients. Some studies even suggest that higher platelet concentrations may provide stronger and longer pain relief. Another benefit of PRP is safety. Serious complications with PRP injections are very rare. Most side effects are mild, such as temporary swelling or soreness. You will have some increased inflammation after the injection. Because PRP is made from your own blood, it's considered a biologic treatment rather than a drug. So how does PRP work? Some patients might ask. To understand PRP, you first need to understand platelets. Platelets are tiny cells in your blood that help stop bleeding. When you cut yourself, platelets rush the area and release growth factors. These growth factors help to repair tissue and reduce inflammation in knee osteoarthritis and other forms of osteoarthritis and tendonitis. The cartilage that cushions the bone slowly wears down over time, and swelling can occur from inflammation. PRP works by delivering a high concentration of your own platelets directly into the joint. The goal is to reduce the inflammation and stimulate healing signals inside the joint. Now let's walk through the procedure step by step. Step 1 is preparing for the procedure. Before the procedure, patients are usually told to stop taking NSAIDs or ibuprofen or naproxen for about 2 weeks before and a month after. These medications can interfere with your platelet function. Acetaminophen or Tylenol is also used for pain control during the procedure. Experts also discuss PRP should not be mixed with cortisone or other local anesthetics because they might have an effect on the platelets. Step 2 is drawing your blood. On the day of the procedure, a small amount of blood is drawn from your arm. Typically 60 to 120 millimeters of blood is collected. This is similar to having routine lab work done. The blood is then placed in special tubes that contain the anticoagulant. This prevents any blood clotting during the process. Step 3 is separating the platelets. Next, the blood is placed into a centrifuge. A centrifuge is a machine that spins very quickly and takes the platelets and extracts it from the blood. After the blood is spun, it separates into 3 layers. The bottom layer is the red blood cells. The middle layer is called the buffy coat, which contains the white blood cells and the platelets. Top layer is the plasma. Depending on the protocol you use, the blood may go through 1 or 2 spins. A single spin method produces a leukocyte-rich neutrophil poor PRP, meaning it has fewer blood cells. A double spin might have less cells than others. Depending on the doctor, they can carefully extract the platelet-rich plasma while discarding most of the other red blood cells that are not used. It can cause inflammation. Step 4 is positioning. We usually do any type of injection under ultrasound guidance, as ultrasound can help provide an accurate injection, getting in the right spot. We also make sure the skin is cleaned and make sure that we're able to really understand if there's any fluid in the joint beforehand, so we can remove that fluid from a separated syringe. We then will inject the PRP. About 5 to 7 millimeters of fresh PRP is injected into the joint using a small needle. The injection is very quick. Some patients feel some pressure or mild discomfort, but it's generally well tolerated. You will usually rest for about 10 minutes before leaving. Mild swelling, stiffness, or soreness can happen for a few days afterwards. Ice and acetaminophen might be considered. NSAIDs should be avoided after the injection because they may interfere with the platelet activity. Patients will often ask, how many injections are needed? Studies suggest that 1 to 3 injections are commonly used in clinical practice. Most patients will have increased pain for 3 days, which is normal due to the inflammation, and then it can take 3 to 6 weeks to take effect. Most patients will work with a therapist or have a therapy protocol that will help them recover across the process of recovering from their PRP injection. PRP does not regrow a knee joint. It does not cure arthritis. It can help calm inflammation, improve joint environment signaling, and reduce pain. It seems to work best for early to moderate arthritis, rather than severe bone-on-bone disease. In simple terms, PRP uses your own body's own healing tools and delivers them directly to the problem area. For the right patient, that can really cause meaningful improvements in pain relief and improve their function without any surgery. What questions do you have? Drop them in the comments below and I'll try to do a future video on it. Remember to hit the like button and subscribe, and I'll see you in the next video.